practices, but perhaps a best strategy is just what you said, partnerships.
Yes.
I think that really is the key to improving not just disparities across between the genders, but all disparities. So I think groups like the Men's Health Group, partnering with different agencies at HHS or outside of HHS even, and even other organizations outside of the federal government to push the Healthy People goals forward. I think that's the key.
Have you guys happened to see certain areas of opportunity that, maybe us on the advocacy side could be able to influence that maybe you all from the government perspective haven't been able to typically hit?
That issue, it came up today. I can't remember who made that statement, but the need to have better outreach with legislation, with funding, et cetera, et cetera. And I know the advisory committee, when they met in January and February, suggested also that we needed to, not we the federal government, but the Healthy People stakeholders needed to be involved legislatively. So that idea is not new, and it's one that has circulated, and it's been a weakness that's been pointed out. So.
I think another partner that is becoming a much bigger piece of this is, for instance, the African American Church is a venue for working on health issues. And I think those kinds of partnerships are very, very important. We can't just assume that we are reaching men. We need to go and explore all kinds of partnerships. And of course, your work with women working for more prostate awareness and less death and morbidity from prostate cancer is a good example.
Yeah, we've definitely, our organization, both of our organizations have definitely been reaching out to the African American church population, so we hope to do more of that in the future, definitely.
And other faith-based organizations as well.
I liked what you said about reaching out to men where they work, where they play, and where they pray, and maybe those communication channels, even slogans like that hit people where they live and they remember it. And I think that's so important that we use those channels when we've got them.
Looking forward to Healthy People 2020. Do you feel that gender disparities will still need to be addressed, and if so, what additional opportunities to do so do you see?
Well, I'd just say that we've already seen the draft overarching goals from the advisory committee. So we don't know what the final goals will look like, but disparities is included in that. And I can't imagine that we would stray too far from what we did with Healthy People 2010. We had our minimum template for each of the objectives, the population template, and gender is one of the entries in that template. So I would be very surprised if gender weren't included still, because there's data collected by gender, by sex. So I would imagine looking forward that gender differences would still be measured. I'd be surprised if they weren't.
It's not going away. You can be pretty sure women are not small men. Men are not big women. There are biological differences as well as cultural differences. We need to collect data by sex on a very consistent basis, and I think we're doing better, and we'll continue to do better in the future.
And I know in a lot of our work that we've done on different partnerships and collaborations with both the NIH Office of Women's Health Research, but also with Wanda Jones and the Office of Women's Health, they've always been fantastic about sharing the most recent and current data that they have, so that we can spread the word. Because for us, it's more about healthy families. We know that men aren't going to get to where they need to be unless we have the women there. You guys are the healthcare leaders in the household, so it's really the buy-in from all the stakeholders in the family to better both of the situations. So both of those partners from the government level have been fantastic in terms of sharing information and collaborating on a healthy family project.
How important is it for organizations like Women Against Prostate Cancer and Men's Health Network to get involved in national health policy debates?
Crucial. Don't you all agree?
Yeah.
I think, the whole point of this open and transparent process is to get people just like you at the table. We don't want to sit around the table and talk to each other. We want to hear from you, and that's the purpose of these meetings, of having every advisory committee meeting open to the public, et cetera, et cetera. So we definitely think it's very important.